Good afternoon, everyone. Welcome back. I'm Steve.
And I'm Scott.
And together we are Backyard Musings. We like to muse.
We
right?
do. Yep. In the backyard in the morning.
Yes. It's cool.
Yeah.
We have the Science and Technology channel. All things science and technology. All right. Common painkillers like ibuprofen and acetaminophen may fuel antibiotic resistance, raising urgent questions about drug interactions in aged care and beyond. Ibuprofen and acetaminophen, also called paracetamol, are among the most widely used pain and fever remedies. But new findings from the University of South Australia, a lot of stuff coming from Australia, suggests they may be contributing to a global health crisis, antibiotic resistance. Not good. This result was presented in Antimicrobials and Resistance on August 25th, 2025. Would you like to know more?
In a pioneering study, scientists discovered that each drug on its own can encourage bacteria to become resistant to antibiotics, and when taken together, they appear to intensify this effect. By examining how these medicines interact with the common antibiotic ciprofloxacin, and I'm just going to say E. coli, a bacterium often responsible for gut and urinary tract infections. The team observed that ibuprofen and acetaminophen accelerated genetic changes, making the bacteria more resistant not only to ciprofloxacin, but also to other types of antibiotics.
Floxacin.
Okay, Daffy Duck.
Wabbits.
So what? I mean, I don't think I've ever heard of that. I mean, I've also obviously heard of acetaminophen and ibuprofen.
I guess
the mainstream
medical study is
right?
showing that, right?
Tylenol.
So my wife, she doesn't take Ibu or acetaminophen. She takes Tylenol. She says she's allergic to.
Tylenol has, Tylenol we have is 500 milligram acetaminophen in each capsule.
I don't know.
You take two of those puppies, you're pounding down some acetaminophen.
Yeah. I don't know why she can't take ibuprofen, but she can take Tylenol. I don't know.
Interesting. Because, I mean, ibuprofen is one of the... I remember when I had some dental work, they gave me a choice. I could either take Tylenol with codeine, which I took.
Yeah, give it to me.
I took it in case the
ibuprofen
didn't work.
Market.
Yeah, right.
Good coin for those pills.
So I'm told. Mind, man. Or 800 milligram ibuprofen. And I'm not an ibuprofen guy.
Horse pills.
Yeah, they're pretty big. But I'm an aspirin guy. That's what I use for my
cold milk guy.
Pain. Cold milk.
That's cold milk.
Yeah.
Yeah. Huh. According to the researchers, this raises significant concerns for vulnerable groups, especially older adults like me, in residential care facilities where multiple medications are commonly prescribed. The findings highlight the need for greater caution around everyday drug use and its potential role in worsening antibiotic resistance.
Okay, the World Health Organization, which not a big fan of these guys after COVID, right?
Yeah.
Reports that antimicrobial resistance is a global threat to public health and that bacterial resistance was directly responsible for 1.27 million global deaths in 2019.
Wow.
Now, that's before COVID, right?
Wow.
Ibuprofen and acetaminophen are two of the most widely used over-the-counter painkillers. I just said that. Ibuprofen, sold under brand names like Advil and Motrin, is a non-steroidal anti-inflammatory drug, NSAID, that reduces pain, fever, and inflammation.
No relation to USAID.
Well, I don't know. Maybe not.
Kickback.
Maybe not.
Funneling of money. Acetaminophen, best known by the brand name Tylenol, is commonly used to relieve pain and reduce fever, but does not have anti-inflammatory effects. Both are staples in household medicine cabinets. We have both. And are often considered go-to remedies for headaches, colds, and everyday aches. I take Tylenol whenever I got a headache coming on.
Yeah, so I take Excedrin, or an off-brand of Excedrin, and it's about 65 milligrams of caffeine.
Mm-hmm.
which you can never have enough caffeine. It's like butter and salt.
Right.
And
Definitely.
Then it's about, and I think each pill is either 250 or 325 milligrams of acetaminophen. And yeah, I take a couple of those, and within 20 minutes, usually, unless there's something really wrong, my headache is gone, or any other pains I have, like back pain,
aches.
Yeah. So,
lead researcher UNISA's associate professor Riti Venter, that's a weird name, Riti, says the findings raise important questions about the risks of polypharmacy in aged care. Quote, antibiotics have long been vital in treating infectious diseases, but their widespread overuse and misuse have driven a global rise in antibiotic-resistant bacteria, Associate Professor Venter says.
Okay.
You want me to keep going?
No. Quote, this is especially prevalent in residential aged care facilities where older people are more likely to be prescribed multiple medications, not just antibiotics, but also drugs for pain, sleep, or blood pressure, making it an ideal breeding ground for gut bacteria to become resistant to antibiotics. We don't want to be messing with the gut bacteria.
Right. That's not fun when your gut is hurting.
Yeah, and you're just laying there, you're not doing anything.
Except for diarrhea and nausea.
Yeah, we don't want to go there either. Yeah.
Quote, in this study, we looked at the effect of non-antibiotic medicines and ciprofloxacin, an antibiotic which is used to treat common skin, gut, or urinary tract infections. Continuing the quote, when bacteria were exposed to ciprofloxacin alongside ibuprofen and paracetamol, they developed more genetic mutations than with the antibiotic alone, helping them grow faster and slowly become highly resistant. Worryingly, that's an interesting adverb. Worryingly, the bacteria.
Does that mean worrying a lot?
Yeah, it's an adverb used to modify a verb. The bacteria were not only resistant to the antibiotic ciprofloxacin, but increased resistance was also observed to multiple other antibiotics from different classes.
Quote, we also uncovered the genetic mechanisms behind this resistance with ibuprofen and paracetamol, both activating the bacteria's defenses to expel antibiotics and render them less effective. Okay, so we don't want to do that, right? We don't want to we don't want to render the antibiotics, because
those help out.
Yeah, they kill the viruses and stuff,
right?
Like
you get inflamed in your gums. That happens to me a lot. And antibiotics chases that away. Okay. The study assessed 9 medications commonly used in residential aged care: ibuprofen, an anti-inflammatory pain relief; diclofenac, an anti-inflammatory to treat arthritis; acetaminophen; paracetamol for pain and fever; furosemide. I have had furosemide and I stopped taking it because I had a reaction to it, for high blood pressure; metformin for high sugar levels linked to diabetes. You get diarrhea from that. Atorvastatin, which I use to help lower cholesterol and fats in the blood. Tramadol, a stronger pain medication post-surgery.
That's a big deal, right?
Tramadol.
Yeah, that's you can hallucinate from that.
Oh.
I don't have any experience with that. What I've been around people that have, and it's
Tramadol.
Yeah.
Let's keep that top of mind. And temazepam, used to treat sleeping problems, and pseudoephedrine, a decongestant.
Right. Okay. Associate Professor Venter says the study shows how antibiotic resistance is a more complex challenge than previously understood, with common non-antibiotic medications also playing a role. Quote, antibiotic resistance isn't just something about antibiotics anymore. That's according to Associate Professor Venter. Going on with the quote, this study is a clear reminder that we need to carefully consider the risks of using multiple medications, particularly in aged care where residents are often prescribed a mix of long-term treatments.
Quote, this doesn't mean we should stop using these medications, but we do need to be more mindful about how they interact with antibiotics, and that includes looking beyond just 2 drug combinations. The researchers are calling for further studies into drug interactions among anyone on long-term medication treatment regimes, so we can gain a greater awareness of how common medications may impact antibiotic effectiveness.
Yeah, that's kind of a big deal, right? Especially if you go to multiple doctors. I know they always ask you, please bring your list of the medications you're prescribed. But even so, I don't think these doctors, I think they zone in on what they're there to treat. And they don't really care about what other, not every doctor, but a lot of doctors that all they're concerned about is treating what they're there to, what you're coming to them to,
I think
to
for the
treat.
most part, that's true.
And yeah, and they end up, just jacking up your body. And then, it's that old deal. Well, it hurts when I lift my arm. Well, then don't lift your arm. We'll take this pill. We'll take that pill.
Yeah, I've got a VA doctor and a Kaiser doctor.
And do they work together?
No, but I guess there's a common system, healthcare system that they look at, software, that they communicate together. That happens.
Yeah, I hope so. But I know there's one for pharmacies. Like you can't, can't be hopping pharmacy to pharmacy to get pain meds and stuff. Yeah, I remember when we were getting my mom some pain meds, and one pharmacy that she dealt with was closed, and we went to this after-hours pharmacy that was open later than normal.
Gave you a hassle.
Wouldn't give it to us. Yeah, prescription won't.
Look, I've got the prescription signed. I don't care.
I had the prescription. They said, "Yeah, we don't care. That's a strong narcotic, and we show that your mom still has available prescription. She should have it." So, yeah, which I thought that was pretty cool.
Well, we sold it on the black market, so she don't have it. Yeah. We needed to get our fix of money.
Yeah, she needs to supplement her income. But anyway, I think that kind of a policing is cool. But when these doctors just prescribe stuff and it doesn't interact well with something else you're taking, and then when do you find out? Maybe sometimes too late.
I was pissed. So they were giving me this one drug for high blood pressure. I take Losartan now. Is it blood pressure?
Is that the little white pill?
The little white one, yeah. Before that, they were giving me something that would make me cough at night, and it was really hard to get to sleep. And one of the nurse practitioner said, "Oh yeah, this one of the side effects is coughing at night." I said, "No wonder. Get me off of that and change the drug." And changing the drug, I don't cough at night.
How is that wearing it? Because you say you wear a CPAP, right?
Yeah, that doesn't matter. If I take that drug, when I'd be laying down, I'd be coughing.
Yeah, with that CPAP mask on, right?
And yeah,
that's not good.
It's just blowing stuff into the mask, making it dirtier.
Oh, yeah,
my saliva and stuff.
Not good. Anyway,
all right, folks,
be aware of what you take.
Thanks for joining us.
Have a good day. Thanks.